Good afternoon, everyone. Welcome to the public session of today's Oversight and Engagement Board for the 29th of October. Apologies that we ran over slightly in our previous meeting, so we're starting at 3:01. I'm going to go straight to the minutes from the previous meeting of the 16th of October. I presume everyone is happy with those minutes. Yep, excellent. Thank you very much. Which brings me straight to Lucy Whiteman for the summary of the local surveillance data for this week. Thank you, Lucy.
Thank you, Councillor Morris. So this is the surveillance data up to the 18th of October. And again, just remind people it's available on the Northamptonshire County Council website and is updated on a weekly basis, but it reports data from the previous week. So people will recognise obviously the main messages that COVID positive 19 cases have continued to steeply increase in the last week up to the 18th of October. And, you know, they are at a point where obviously there is significant local concern. And the primary cause of transmission continues to be household transmission. So people mixing indoors and within each other's homes. Obviously, because a lot of people don't have symptoms of COVID-19, it is quite difficult to identify when people are positive, and therefore, as they mix between households, unfortunately, there does seem to be a lot of onward transmission. So if we go down, obviously we talked about the fact that we are a level 1 area. The whole of Northamptonshire is at the moment, all boroughs and districts continue to be in level 1 medium risk. From a point of view of our main messages, particularly over this week, which has been half term, because although it being a medium risk area means you can mix indoors with up to 5 other people, our main messages on the next slide are that during half term we are asking parents to be firm because of the fact that we're looking at the evidence of onward spread locally. We have been able to see that household mixing has been one of the main causes of the increase in cases. And within children, also sleepovers have been cited in a number of the outbreaks that have been associated with schools. We're just making a recommendation to parents to think about whether they should be mixing indoors at all and to avoid sleepovers where possible. Obviously, if households aren't mixing, then you aren't able to obviously transfer the virus between those members of those households. So please, encouraging people just to play outside in the park and obviously avoid sleepovers, as I've said. If we go on to the next slide, obviously we've still got the continued links to the current guidance. And if we go down to slide 8, to the main data picture, the week ending the 18th of August, you can see that we had 785 cases across Northamptonshire. That is an overall increasing trend for the last few weeks. Apologies, we seem to have lost the slides there. I'm sure we'll get them back up as soon as possible. So there's an increasing trend over the last 2 weeks, and unfortunately that does continue into the last week's data as well, and that will be reflected in tomorrow's surveillance reports. And indeed, on the week up to the 18th of October, cases had more than quadrupled compared to the 21st of September. So if we look at slide 9, which gives us a breakdown of the age ranges and gender, we have got a reasonably even distribution of cases between females and males. Obviously, when we saw the return to school, we also saw that significant increase in the 10 to 19 and with universities of 20 to 29-year-olds. Having said that, I'm sure those that have been following these reports week on week will notice that there's been an increase in the older age groups, the working age population. And the area of particular concern is the fact that cases are increasing in the over 60s, and it's those over 60s that are at significantly increased risk of having a hospitalisation or a poor outcome from COVID, particularly if they have a long-term condition as well. So that's an area that we continue to watch carefully, and it is one of the sort of soft thresholds from a point of view of escalation to other areas as well, to other levels of lockdown, I should say. From a point of view of our borough and district breakdown on the next slide, people will see that overall Northamptonshire has had obviously an increase in the number of cases as compared to the previous week and previous. 2 areas ended up with a small reduction in the number of cases, that's Corby and Daventry. Otherwise, all other boroughs and districts had an increase in the crude number of cases. The better comparison is on the following slide, where we compare areas using a rate as if they all had 100,000 population. For Northamptonshire, the rate per 100,000 population as a rolling 7-day average is 99.2. We've got 3 areas that are significantly, are above the area average, Northampton being statistically significantly so. Those 3 areas, Northampton, South Northamptonshire and Wellingborough, having a rate of over 100 cases per 100,000 as a 7-day average, which is again a concern and quite a significant trigger point from a point of view of looking at different interventions that should be taken. The next slide just shows that pictorially, so you can see the increase in cases across all 7 boroughs and districts over time as compared to the England average. I think one of the things that's notable here is the fact that we obviously had seen a much slower increase in our cases as compared to the England average a few weeks ago, sort of at the beginning to the end of September. But in the last few weeks, you can see the gap between the borough and district rates and the England average there closing, which demonstrates the fact that our case increases is much more rapid at the moment locally than it is compared to the other England areas. From point of view of school position, on the next slide, you in the week up to the 19th, the data includes for schools, you had 9 outbreaks. There were 92 cases involved in those 9 outbreaks. So you can still see that when there is an outbreak in the school, there usually are quite a number of students and staff involved. The university reported 27 cases that week. So that was the total number of people that they had that were COVID positive, not all living on site, but obviously enrolled as students for the University of Northampton. And at that point in time, 99% of schools were open and 91% of pupils who were eligible to be attending were attending, as compared to 94% at the same period the previous year. So that had reduced, but that's obviously, if you look at the number of outbreaks, likely to be due to the fact that the number of people who have been isolating as part of the bubbles and the policy and approach that's been adopted by schools locally. So the next couple of cases obviously give us a breakdown of cases by community and the wards that are most impacted. Slide 14 showing us the number of cases in the most affected wards. Again, these are closely correlated with outbreaks either in schools or in some cases in care homes or workplaces. As I said, there still is a significant proportion of community transmission, and that's why we're asking people not to be obviously mixing between households. If we go down to slide 17, it gives a picture of the outbreaks as at the 18th of October. At that point, there were 32 in the county, and that involved 187 positive cases. Again, as we've talked about before, an increase on the week before, so just demonstrating a similar pattern to the increase in the community incidents, but again, also an increase in the number of cases per outbreak on average. So more people being affected each time there is an outbreak. That number again this week has increased further, and we continue to work with all of our colleagues to make sure that we obviously provide as much advice and guidance as possible to not only the settings where these outbreaks are identified, but the individuals themselves, because the key factor is still that a lot of the transmission happens actually outside of the workplace or outside of the school environment. It's not the environments themselves that we're finding on the most part that pose the risk. So I think there's a key message there as well. Obviously, the last slides, as always, contain our key messages and any links to any of the resources that we're able to provide locally. So if I stop there and take any questions, Chair.
Thank you very much, Lucy. A very thorough run through of the figures, as always, although obviously the trend is slightly alarming and something we need to keep an eye on, obviously, and I'm sure that's what's happening. I'm looking around the room to see if there's any questions. There don't appear to be any at this particular point, so I'm going to move straight on to the Halloween and bonfire night guidance, which, given the sort of rising case rates, I think is going to be crucial for the next few weeks. So Lucy, it's over to you again on that.
If I just give key headlines, because some of this will be covered in the comms update as well, but obviously because of the community transmission here and the risks and the fact that all boroughs and districts are now obviously seeing an increase in cases overall as a trend, even if there's fluctuations week on week. The police have pulled together a brilliant campaign which is being shared across all of our partners around the ability to encourage children absolutely to dress up, to go out with their parents or within their own support bubble. For people to put posters and or carve pumpkins in their windows, for children to be discouraged from actually knocking to physically trick or treat, but when they see a pumpkin, to be given a treat by the parents or the guardians that they're with at the time. And it just means we're limiting the sharing of items between households and any potential household-to-household contact. So hopefully it's a good alternative. People still get to dress up, they still get the treats, but we're just doing it, encouraging people to do it in a safer way. From a point of view of bonfire nights, obviously I'm aware that a lot of the events that would usually be arranged have been cancelled in light of current COVID guidance, and I do appreciate that a lot of people will be disappointed by that. The environmental health officers and the police have been working with outlets that obviously provide fireworks, and I understand although some people obviously are purchasing them for their own private use, that sale of fireworks is down, and obviously fire working very closely with police and environmental health officers to make sure that if people are purchasing them, that they understand how to use them safely, and they understand what to do if there is indeed an incident. But I'm sure Claire will cover more of that off in the comms report.
Thank you very much, Lucy. Again, I'm looking around the room. Doesn't seem to be any questions. I think we'll probably cover more of that in the press conference tomorrow, hopefully as well. So that would be very good to get all those messages out there. I'm coming on to Sharon Wright. Hi, Sharon, and a testing update. Hi, Sharon.
Good afternoon, Councillor Morris. Testing update, we still have good capacity in our laboratories to undertake testing, which gives us a full complement of appointments within our system. We've still got a regional testing site in Kettering, along with our local testing sites in Kettering, Corby, Wellingborough and Northampton. We are imminently moving the Northampton one from the Market Square down to the university campus, in light of getting ready for some Christmas festivities to go on to the site, the Christmas tree and other things into the Market Square in Northampton. So we will be surveying the site at the university and starting to build next week, in view of starting testing at the university the following weekend. So that will hopefully not give us too much of a gap in testing in Northampton, if any at all. But I'm just waiting to just see how the logistics follow on that. So that is really news. We've got 2 MTUs roving in the county, and currently this week they're at Sywell Airport and down in Daventry, and they'll be moving elsewhere into the county next week. We have got various other opportunities of different sorts of testing, new innovations coming forward, and there'll be some asymptomatic testing being promoted across prisons and GP for primary care practitioners, as well as more asymptomatic testing in NHS hospitals. So there is all sorts of things coming online over the next few weeks to increase testing of individuals across all sorts of systems. I'll take any questions if there are any. Oh, sorry, I've forgotten one thing that is really important. The Ministry of Dissent has indicated they are going to disrupt testing at all locations over this weekend, Saturday and Sunday. Information has been shared with the police and they're going to be putting things in place, and it has been shared with district and borough colleagues so that we can put local solutions in place, as well as the testing sites are being briefed on what they need to do about it. It's low harassment more than anything else, but just to be aware that we will probably have some problems in county over the weekend.
Sorry, may I just add to that? It obviously there are extra patrols and extra support being put into the testing site, so we don't want people to be dissuaded from attending their testing appointment. It's just to be aware that the fact that obviously there may be police presence, and that is just so that we can try and maintain as much order as possible and allow people who need access to the testing site to be able to do so.
Thank you very much. I mean, safety of people is always paramount, of course, and hopefully it won't be necessary to do anything draconian as a result of what might happen. But thank you, Sharon, as always. I'm looking around the room. There are no questions as that I can see. So we come back to you, Lucy, now for contact tracing update. And again, of course, this is all part of the arsenal of weaponry we have against this virus.
Thank you, yes. So contact tracing is still going really well, and we have undertaken, as people have heard earlier today, further surveillance and a survey about people's behaviours, so understanding what obviously encourages people to self-isolate if they're identified as a contact or a close contact of a case, or if they're a case indeed themselves. And we're obviously utilising that insight to help us develop some support services so that when people are isolating, they're able to receive information and guidance and encouragement to continue to do so, because it is such an important element of breaking the chain of infection locally. We are still reporting high numbers that are coming through to the Northamptonshire, the local contact tracing service. At the moment, we're getting around 30 a day. We do have enough staff to be able to manage that, and our overall success rate is obviously building on the national success rate as well. Clearly, there still are a number of people who choose not to disclose any information, and obviously want to take the opportunity to encourage people to engage fully in the test and trace process. It is only by breaking the chain of onward infection that we are likely to avoid certain lockdown restrictions being imposed on us, and therefore the more people that engage with this process when they've been identified as either a case themselves or a contact, the more likely we are to be able to see a Christmas that does allow us to see other people, or perhaps to go out and about. So it's the actions that we take now that obviously will put us in a better stead in the long term to obviously exercise our freedoms. But it is, people can see from the numbers here, this is a real challenge, and only by being clear about who we may have exposed to the virus are we going to be able to get on top of this.
Absolutely, and I think we all concur with that message. It is incumbent upon all of us in Northamptonshire to follow the rules and to follow the testing, contact and follow up should it happen. So we would always reaffirm that. I'm going to come to Claire Hughes now. Claire, for your comms update. Hi, Claire.
Hi, good afternoon, everybody. Yes, just to reiterate what's been covered already, from a comms point of view, again, our priorities are continuing to be informing people to still continue to get tested. We're obviously trying to make sure that messages around the tier restrictions and guidelines that we're all in, everybody can understand them and that they know what they're supposed to be doing. Also, the rule of 6 and the inter-household avoiding activities wherever possible. Obviously, we've got coming up in the next day or so, Halloween and bonfire night. Usually a lot of inter-household mixing and people grouping together. We've been working with the fire and police teams to share messages around trying to do things a bit differently, making sure that we're not having this transmission between households, and also sort of staying safe. So trying to avoid, as Lucy said earlier on, doing trick-or-treating, but doing it in a different way where we're not handing out sweets and passing items between households to try and reduce transmission. So we've got lots of information on our social media if anyone wants to see that, and lots of great ideas and links to alternative ways to entertain ourselves on these events. We've also conscious that once half term is finished, schools will be going back, primary and secondary schools. So we have some weatherproof posters that we've been talking about over the last couple of weeks. Again, just to remind parents and people of good social distancing practice when they're dropping off and picking up children. So hopefully they will be delivered out and with schools ready for after half term. Hopefully some people have also heard we've got a radio advertising campaign going on some local radio stations. Again, those are all trying to encourage people to recognise that we really need to try and do our activities in a slightly different way. We're not the sort of stop fun police, but we're just talking about having it in a slightly different way and being conscious that our actions have consequences, and so therefore we need to act safely. Hopefully some people, or most different groups, will recognise those scenarios, and we're trying to offer alternatives. If you're also following our social media, you'll see that we've now got active our Ask Lucy session. So over the next, I I think 48 hours or so, where anybody's able to ask Lucy a question that they feel they have that they haven't got answered anywhere else. Hopefully Lucy will rise to the challenge, but we'll be playing that back in due course when we've collated all of the questions, and hopefully we can get that all sorted for people. I think that's probably covered off most of the key things that we're working on. But as usual, everybody, you know, we target people, but we're targeting everybody. There's different messages out there about what to do, whether you're young or old, but please be safe and take note of the messages that we're trying to get to you. Thank you.
Thank you very much, Claire, as always. And thank you for your hard work and the comms team's hard work, as always. As we know, these things move on a weekly basis, it seems. Things change very quickly. And I think the comms team have done a marvellous job at adapting the messaging as we've gone along in this process. And as we move further into the process, in some ways, I'm sure you will all step up to the plate and work very hard for the people of Northamptonshire, for which we can only thank you. Thank you very much. And that, I think, unless there are any questions, I'm just going to come to, I'll just slide in any other business and looking at Lucy if she has any other business. Lucy? No? Anyone want to bring anything up? No? Brilliant. Okay, so the last item is the future meeting dates. We've got a couple, we've got quite a few. We've got the 5th of November at 8:30 a.m. the 12th of November at 8:30 a.m., the 19th of November at 8:30 a.m., and the 26th of November at 8:30 a.m. Seems that the 8:30 a.m. is the common theme there. I know everyone loves those early starts. Can I just say thank you very much for everyone's attendance today, as always. I think they're very robust sessions, both in the private session and in the public session. So I wish you all a very good afternoon and see you next week on the 5th of November at 8:30. Thank you very much. Good afternoon.